All right, today we're going to play medical detective. We're diving deep into a puzzle surrounding a really common back surgery, one that's super effective but can sometimes kick off a whole new problem just a couple of years down the road. So, let's get into it.
So, picture this. You've gone through a major surgery to fix that debilitating back pain you've had for years. It's a success. You're recovering, feeling better, and then a new kind of pain starts up. It's right next to where the surgery was done, and it's only been a year or two. You'd be thinking, what is going on here?
The surgery at the heart of our mystery is called a posterior lumbar interbody fusion, or PLIF for short. Now, this thing is a real workhorse procedure for serious back problems. The whole idea is that a surgeon goes in, removes a disc that's causing trouble, and then fuses two or more of your vertebrae together. The goal? To create one solid, stable piece of bone. And for a lot of people, it is absolutely life-changing.
But, and here's the twist, there's a catch. When you fuse one part of your spine, making it totally solid, the levels right above and below it suddenly have to work overtime. They have to pick up all the extra slack for bending and twisting, and sometimes that added stress just wears them out. This problem has a name, adjacent segment degeneration, or ASD, and that is the villain of our story.
And we're not talking about some rare thing here. A recent study dropped a pretty startling number. This early-onset ASD happens to over 20% of patients, and that's within just 2 years of their fusion surgery. I mean, think about that for a second. That's 1 in every 5 people who get this major surgery developing a brand new, significant problem right next door to the old one.
So, this obviously leads to the big question researchers have been wrestling with. Why is this happening so fast? And maybe even more importantly, can we figure out who's most likely to be in that 20% before they even have the surgery?
To find some answers, we're cracking open the case file on a 2024 study that came out of Japan. A team of researchers there basically said, okay, let's go find the hidden clues. Let's track down the risk factors and solve this thing.
So here's how they did it. They did what's called a retrospective study. That just means they look back through the detailed medical records of 170 patients who had all had the exact same operation, a single-level PLIF at the L4-5 spot in the lower back.
So within that group of 170 patients, they found their 2 key populations. You had 35 patients who, developed that early ASD. Then you had 135 patients who were doing just fine. The investigation from there was pretty straightforward. Compare literally everything between these 2 groups. Their age, their weight, the specifics of the surgery, their MRIs from before the operation, you name it, they put it under a microscope. All to find out what made that ASD group different.
And after they crunched all the numbers, 3 main culprits started to stand out. The first clue? The amount of vertebral slippage the patient had before they even got to the operating room. It turns out patients whose vertebra was already slipping forward a bit more had a higher risk. Now, the second clue they found wasn't about the patient's body, but about the surgical technique itself. There is this thing called disc distraction. It's where the surgeon stretches the disc space open to fit the fusion cage in. Well, the researchers found a magic number. Stretching that space more than 4 millimeters was a clear risk factor for developing ASD later.
But you know what? Those first 2 clues, they were interesting, but they were nothing compared to the third one. This was the smoking gun. The single biggest predictor was something you could see on the patient's MRI before a single incision was made: vertebral bone marrow edema. That's just a medical term for what's basically a sign of inflammation and stress inside the bone of the vertebra right next to the one getting fused.
So just how big of a deal was this little sign of inflammation? The analysis was jaw-dropping. Patients who had this bone marrow edema showing up on their pre-op MRI were, get this, 16.8 times more likely to develop early ASD. I mean, that is not a small connection. That is a massive flashing neon sign.
And this chart really just lays it all out crystal clear. Look at this. For the patients who went into surgery with that bone marrow edema, almost 60% of them developed early ASD. But for the patients who went in without it, that number plummets to just over 13%. So this wasn't just a clue, it was a huge warning sign that was visible all along.
The researchers themselves were pretty direct about it in their conclusion. They said that the need for this kind of surgery requires careful consideration if this edema is found beforehand. In other words, seeing that inflammation on an MRI totally changes the risk-benefit conversation.
Okay, so what in the world does all this mean for you, or for anyone you know who might be thinking about this kind of surgery? Well, this research isn't just for doctors in a lab.
It's an incredibly powerful tool for patients. It gives you the knowledge to have a much smarter, more informed conversation before you make a huge decision. So let's break down what you can actually do with this.
Here are the key discussion points for your doctor. Step 1. Ask to review your pre-op MRI with your surgeon. Sit down and look at it together. Step 2. Ask them specifically, do you see any signs of bone marrow edema, that inflammation on the bones next to where you plan to do the fusion? And step 3, based on that answer, you can talk about how the surgical technique, like maybe being careful not to stretch that disc space too much, could be tweaked to lower your personal risk.
You see, what this study really represents is a shift in thinking, from just dealing with complications after they happen to actually predicting them before they start. Being able to spot these high-risk patients before they even get to the operating room, well, that opens the door for treatment that is truly personalized. It leaves us with a pretty big question. Could something as simple as paying closer attention to a pre-op MRI scan completely change the future of back surgery?